A continuación, tenemos la conferencia Future of the Profession of Respiratory Care Worldwide, futuro de la profesión del cuidado respiratorio en todo el mundo, a cargo del Dr. Jerome Sullivan. El Dr. Sullivan es PhD, Presidente y Miembro del Comité Ejecutivo del Concejo internacional de Terapia Respiratoria, Profesor Emérito de la Universidad de Toledo. Bienvenido, doctor.
Primero, I would like to thank the organizing committee, the Universidad Andina. I would like to thank Libra and Alcofactor, the Association of Respiratory Care Faculty here in Colombia, for inviting me and having me here in Bogota. Thank you very much. My presentation this morning, obviously, will be in English. I'm learning from mi amigos and from my children. My oldest daughter is a surgeon at Ohio State University in Columbus, Ohio. And she has traveled extensively in Honduras and Mexico and throughout South America and Spain, España. And she has an excellent command of the Spanish language. So she teaches Papa. My son Daniel is an honors student in Spanish, and he's now at the University of Cincinnati. And he also teaches Papa. So yo estoy aprendiendo, ¿sí? We're going to look at some slides this morning which are more about people working together than anything else. And I'm going to talk about the International Council for Respiratory Care and its role in securing the future globalization of respiratory care around the world. And you give me a high sign if I talk too fast, okay? You've seen this one, and that's the best slide I have in Spanish. I would like to say we're very proud that this program was accredited by the International Education System, IERS. We worked very hard. Amparo and her team did lots of work. And Marcella Sprawl, that you've met before, helped translate the application. And so this program was reviewed by my team back in the States, and it was approved and accredited, and we are very proud to add this to a list of educational programs around the world with this designation. And that's part of the purpose of my talk this morning. I want you to have an idea that while we're here today, there are many other physicians, nurses, respiratory therapists, students around the world who are studying the same things and working very hard to help enhance patient care for respiratory patients. It's very much about what the International Council is about, and what our future is about, is working together. This is a picture of some important people. Primero, my wife, Kathy. She was with us last year in Tampa at the AARC International Congress, and along with a number of individuals from outside of the United States. These are members of the International Council, including Dr. Lee. This is Hassan Al-Araini from Saudi Arabia, Chia Chen Chu from Taiwan, Mr. John Heiser from the United States, and two other physicians that joined us from mainland China. Again, my point is all of these individuals are committed to and working toward the globalization of respiratory care. Again, Dr. Lee and Dr. Wang and myself, we had some preparations before the meeting. This was unusual because even though Taiwan has been a member of the Council for many years, we have finally admitted mainland China to the International Council, and it has two new governors that we're very proud of, and I'll show you here momentarily. Each country on the Council has governors, and the governors serve as a conduit for information in and out of their home country. So a governor for China is the one responsible to receive information from the Council, take it back to their membership, and vice versa. If they want to pass information back, they send it back to the Council. So we have worked very hard over the last now almost 25 years to develop this system for communication. And of course, we're glad to say that Colombia is one of the 29 members of the Council, and we'll say more about that. This is, again, an example of one of the programs that was approved by the IRS system, which is a system developed by the International Council and approved by the American Association for Respiratory Care. Hence, you see the logo of the International Council for Respiratory Care and the logo of the AARC. This particular program, which was held just this past June in Xi'an, China, was again a level 1 program. It lasted 3 days, but it brought experts from around the world to China to do exactly what we are doing here today, as we are looking at how to globalize the profession that many of you students are studying for right now. And I will tell you that it has been a long journey and a fun journey, but it was something that started out about 25 years ago, very small. I believe you would appreciate that the past is prologue to the future. If you don't look back at your history, you're really not going to know what's going to happen in the future for a profession like respiratory care. I did mention that we had two new governors that joined the International Council last year. Again, this is a picture that was taken in Tampa, and this is, her favorite name is Jean. Her Chinese name is very difficult, so we all call her Jean. This is Dr. Zhang, and this is our friend from the Executive Committee, Hassan Al-Araini from Saudi Arabia, who joined us again, and he has been working with a number of us for a number of years. Importantly, in the background, you see this, this sign, which you'll see another picture of. It has the mission statement for the International Council on it, and yesterday Marcella did an excellent job talking about mission and our objectives and what we're about. So I'm not going to repeat that. I'm going to continue emphasizing the emphasis on people and interaction and cooperation across the borders. let's see where we officially start before we start talking about the future and what we would plan to do. We were established officially in Atlanta, Georgia, in conjunction with an AARC annual Congress, December 9th, 1991. And if you want to go to either of these addresses, you can, to learn more about the Council, or you can go to the AARC, the American Association website, and click on International, and it'll take you right to the Council. The important point here, even before this, 5 years before this, I began to notice more and more international colleagues coming to the AARC annual meeting. And we had a small reception in my hotel room in 1986 for about 5 or 6 people. In 1987, we had a little larger reception in my hotel room for about 10 people. In 1998 or 88, it was about 30 people. And in 89, we had to push the furniture aside in my hotel room to fit all the international participants in the meeting. It was growing, and people wanted to learn more about respiratory care. They wanted to learn more about how to take care of their patients. They wanted to learn more about standards of care and international standards of care for curriculum, for credentialing, and for the approval of schools. So this is where the spirit of the International Council began to emerge, and this is where those of us that were working in it early began to formalize the bylaws and the whole function of the Council. And again, I have to stress, this provides an interaction across the world for all of us that are working in respiratory care, be they physicians, nurses, respiratory therapists, clinical engineers in Japan, medical assistants in Malaysia. I think some of my colleagues that are here will attest to the fact that we've been able to be very successful in getting that communication going. You did see a slide from Marcella yesterday outlining the names of the countries, and we are very happy and very proud that all of these members are involved in the Council. They all have governors, and they all vote on actions that we take, and we work on common issues that affect us internationally every time we meet. I'm going to be real careful with our time this morning to make sure that we stay in the limit, but I did want to share with you some of the important points that we feel must be stated. We're all about improving patient care on a global scale and enhancing the art and science of respiratory care. When we work with a member country, we try to analyze what the unmet needs are for the patients in that country. As an example, we are currently working with the massive market of China, and they have many patient needs for quality respiratory care. And we are going to continue to work with them to make that happen. One of the things that we do is we serve as physician extenders. When the physician can't be there, or when the nurse can't be there, respiratory therapists that are properly trained, that can do safe clinical work and have a credential, that go to an approved school, are the kind of people we want out on the professional front lines. Not in the United States, but across the world. And that's part of what our mission is. And certainly, one of the additional things that we do are trying to recognize our colleagues excellent colleagues in respiratory care education and clinical practice around the world. And I'll show you that briefly here in a moment. One of the projects that we have been working on for a number of years is the development of a fundamental respiratory care support course that will be translated into multiple language and given in the home country's language. That's a big project. We've been working on it for a number of years, ever since 2004 when it was discussed. And we have had great success in recent months, and we're moving this project forward, I'm glad to say. The fundamental respiratory care support course can be offered in any country. In native language is our goal, and it can be a 4-day comprehensive course intended for implementation outside the States for healthcare providers that are not experienced in respiratory care. You may appreciate that in some areas there are patients that are taken care of by individuals that have no idea what oxygen is. They have no idea what a microprocessor-driven ventilator is. They have no idea what a blood gas is. They don't know how to apply equipment properly to the patient. And yet, we submit some of our patients to this kind of care on a global scale. And so, I'm not talking about the fine training that you're receiving here in Columbia. By the way, Columbia is different. You have university degree-granting respiratory care programs. You are on the upper end of the spectrum, and we're very happy to say that. So when we have these individuals that are not experienced and yet they have patient contact, we are going to offer this program under the auspices of the AARC and the AARC to enhance patient care. Some of the considerations in the future that we are looking at are basic 2 to 4 day seminars. There are longer programs, 6-month programs, 9 months, even potential degree granting programs that we would offer in partnership with the home country. And I had a brief meeting yesterday afternoon where we were talking about some of those opportunities here in Columbia. This IRS that you have heard me talk about is designed to be a web-based recognition system where the IERS system will provide formal recognition. Because what we're concerned about when individuals put on programs and seminars is that they are high quality and that they are consistently high quality. That's what we're about. And as I said, these standards have been approved by the ICRC and by the AARC with physician, therapist, nurse, technician input through the years. This is a repeat of that IRS certificate of approval that I showed you from China. But I wanted to show you that there's a little more activity around the world than you may imagine. This is a summary, and this is just a 1-year snapshot of some of the programs that have been approved. And if I've missed anybody, I apologize. Because now we can include Colombia in this list. Mexico has been there many years. But you see that we have had approved programs in Argentina. Sorry, in Argentina, in Japan. Japan has had over 20 IRS approved programs. Saudi Arabia, United Arab Emirates, Italy. In Italy, for example, there's a master's degree program. First you have to graduate from a physiotherapist program. Then there's a master's degree program in respiratory care. And this is one of the ones that we've approved. So the future of respiratory care has got to be safe, quality, consistent patient care. It only comes through education. It only comes through training, clinical practice, and following international standards of best practice. That's why we are doing this in many, many countries. Where are we here? Okay, here's another one that was approved recently in China, Changsha City in Hunan, China. Here is respiratory care in the intensive care unit, which was also offered in another major city in China. But as you saw earlier, this is a phenomenon that's all over the world right now. Here is a bachelor's degree program in Taiwan. It is a level 3 approval, which means it's a degree-granting bachelor's degree program. High quality, great people. Here is a Japan seminar, and I wanted to share with you in Japan, for example, they offered this seminar to 40 physicians, only physicians, and the program subscribed over 100, so they had a waiting list. So they've given that program several times now, because the demand is very high. Again, here's another one in Japan. And then this is to take you to the other side of the world as an example. In Abu Dhabi, we approved the level 2 program. And as I'm moving towards the conclusion of my talk, I wanted to share with you one of the other things that we do, and that is to recognize excellence in practitioners and programs around the world. We have 2 main awards. One of them, the Hector Leon Garza MD International Achievement Award. And Dr. Leon, would you stand up? This award was named after pioneer in respiratory care in Mexico. So this is the man who this award is named. Now, another pioneer back on the other side of the world, I'm almost finished, if you want me to stay on time, is the Toshihiko Koga MD International Medal. This is another pioneer who I worked with since 1992-93 to help them establish respiratory care quality programs in Japan. I remember the date because that's when my youngest son was born, Daniel. And I couldn't go to the meeting in Japan because he was being born at the time. So I had to stay home. Here is a presentation of some individuals at the Tampa meeting, and this is a presentation of the Koga Medal. All these individuals are winners of the medal. And bear with me for a moment. This is Derek Linsman, who was a governor at large, who was given the medal. Chia Chen-Chu from Taiwan was awarded the medal in previous years. Patrick Dunn, who is a member of the Council from the United States. Many of you may know Patrick. Michael Amato. And this individual here is the Gary Smith, who is in charge of the executive director of the National Board for Respiratory Care. So there's been a number of luminaries that have been given this award. Very quickly, last year, Dr. Sukung Lee from South Korea won the Hector Leon Garza Award. This is him receiving the presentation at the AARC meeting in Japan. In the States. Here are a couple of my colleagues working at an actual ICRC business meeting. Again, Dr. Garza, and then here is Hassan, and right over here is one of our colleagues from Japan. So actually, if there was a shot around that table, there are 20, 25 governors that sit there, 15 guests, and a number of observers. If you ever come to a meeting in the States, the annual meeting, you're welcome to come and observe. Here is just a shot of some of our colleagues. They're from Italy. This is where they have the master's degree program. fantastic people, great workers, lots of fun. And we have a singing contest at the end of every meeting. They're usually first or second place. Hectory's usually first. I'm laughing. And this is just a shot of some of the guests who are sitting around here at our last meeting. So, I did run over a little bit, I apologize, but I think we made up some time. And I'd be happy, I'll be here throughout the day to answer any questions, and thank you again.